always think it's important to try and encourage people to carry on joining in the community, because I don't like people thinking they're coming to an institution and now they've come into a nursing home, they're behind locked doors and they're not allowed to access the community anymore. So it's about involving the community in here with us, and also us in with the community as well, and we do try and get them out to as many things as possible of what's been on offer in the community for them. I've always wanted to be a nurse from whenever I can remember, from being tiny, and there was a nursing home that was near my home, and I used to go out and help at weekends. I've been in the care sector 25 years now. That's all I've ever done, and I love it. You see the changes in people. You see family members right from the very start when they come and they're anxious and maybe stressed and upset. It's nice for them to come and meet you, and instantly after meeting us and looking round and looking on the website and the Facebook page and talking to me and the staff, it's really nice to see the transition that we can do. And when the relatives are saying, "Oh, I didn't think my mum would ever do that."
Having been in the care sector for a long time, over 20 years now, I've seen the model of care that we're having to supply change, because the needs of people are changing and the environment in terms of what the NHS can provide are changed. It's all very much reduced. And what we're finding is that there is an enhanced number of people coming through now with a diagnosis of dementia, but there's also other issues that are contributing to changes in the health and well-being. Not just physical changes, but emotional changes. And what we're finding is that can be linked to where they're located, where they're living, if they're suffering isolation, if they've had a loss or a bereavement. Offering a reablement service, so offering people short-term snippets of care to try and work out why they're at this impasse, why they're accessing GP services or NHS services a lot more often, and giving them little shorter breaks to get them out of their environment, to really convalesce and build them back up emotionally and physically, depending on what they need. Home care services, so creating an umbrella of care, so we have a residential setting which we can help you with long-term or short-term care or reablement care, but then extend that into your own home, so you have the same package of care and you have the same team of people looking after your care management. And like within a residential setting, when we are doing our visits, we can see if there are any changes, so we can be preventative, because we have a closer hold on your care management and your personal care plan. I think it's the only way forward. The NHS as it is isn't sustainable. Social care as it is isn't sustainable, and there has to be this new model of care. We have to look at resilience, and the way to be resilient is to move forward and look at different ways of helping people without it being medical intervention all the time. And it's recognising that the social care sector can actually provide a real support to the NHS. We do have a lot of skills, a lot of experience, a lot of passion within the social care field, and I really do feel that is the future.
Through my friend, his father had a domiciliary care company and offered me a job at the time. The hours were very flexible, it had a great work-life balance, so I took the challenge, and I found it very fulfilling and very rewarding. Great job. The diversity, really, there was a range of different things. You're introduced to new environments, you meet lots of new people, and there is never a dull moment. Going home with a smile on your face at the end of the day, knowing you've made a positive impact on somebody's well-being, it's a really good feeling. Just knowing that you've helped somebody and just made a real positive impact on their life and helped them to do something that otherwise they couldn't have done without your input, basically. Yes, I would. If you're positive, friendly, caring, with a positive attitude, I would definitely recommend that you pursue a career in care.
Each Step Blackburn is a service that supports people living with dementia each step of their journey, from diagnosis all the way through to palliative support. When we opened Each Step, we had a vision about how we could support people to live a better life through meaningful occupation and engagement, and ensuring that we address people's wants as well as their needs, and focusing in that order on wants and then needs. Yeah, I mean, we work really hard to understand the people that we support, and we've partnered up with Helen Sanders and Associates to use their person-centred thinking tools to ensure that we're asking the right questions about the people that live here. So some of the innovations that we have is season tickets with Blackburn Rovers, because some of the people live here love Blackburn Rovers. Other things are that we tailor activities around arts and crafts, specifically around people's skills and talents. Other things is that we've got a cinema, a garden room, where people can be engaged in activities throughout the day without needing to have it planned or structured into their day. Susan came here in May when we first opened, and quite quickly it was apparent that what she wanted to do was different than what the people wanted to do. She goes out independently every day, and that's really important to her because she needs a sense of maintaining her own direction in life. She's worked all of her life and in a few different jobs, and has a lot of skills and talents that she wants to still apply.
My husband died very suddenly, and I just flipped, really, and I couldn't have lived unless I was here. I couldn't have managed it. And I will be working in the reception, and it's heaven to me, because it just focuses then in certain things, and they're all looking after me.
To be recognised in 2 different sector awards, the National Dementia Care Awards and the National Care Awards, for both Best Manager for myself and for Best Care Home, which is a fantastic achievement for the team. It really is reflective of that model of support that we're delivering, where we acknowledge people's skills and talents, both members of the team and people that live here, and make connections between them to enhance the support. It's obviously a fantastic honour. It's something I'm incredibly proud of, but testament to the hard work that the staff teams do here every single day, doing the right thing.
I have been in the care sector, it was 7 years in January, and I've been at the same place all that time. When I started, I was really fumbling in the dark. I think I wasn't quite sure what to do, but 7 years on, yeah, just love it, absolutely brilliant. I'm the activity coordinator there, so I think when I first got there, I was very unsure, really didn't know what I was doing. But now I think I've learned so much from the residents, the other team there, and family members, that I run a big programme every day, different activities. This morning we've already had a film on, doing Christmas craft, we baked yesterday, so lots of things to keep our residents busy and entertained. Care home, we've got 31 residents and people coming in for daycare, which is lovely. There's just lots going on, and actually learning to get to know your residents is the bit that helps. Once we know their interests and activities that they like, we use photographs an awful lot. So it's just learning to get to know them, which will help that relationship, that bond, and then the activities come from there, really, to be honest. Short story long, a great aunt had dementia, and I was visiting her in the hospital, and my mum said I would be good at doing it, and I said there was no chance I'd be ever doing anything like that. Within a year, I was at Home Manor, and I can't think of doing anything else, to be honest, at the moment. Every day's different, the residents change, we get new people in, and we get involved in as many things within the care home and outside the care home as I can. I'm somebody who says yes, and then just gets on with it and tries to organise everything for the residents. They need so much stimulation, like we all do, and they need interests. And I just think every little thing we do makes a big difference to them, really. And actually being with the families, we've got some good connections with families, and if we've got their support, then working with the family member just makes it so much easier. And then as we work together as a team, the team whoever's on that day, I think they're now understanding what activities mean. It actually helps them during the day if the residents are more settled and happy. It's a win-win situation for us all then, and especially when somebody's new. It's not easy to come into a place with other 30 strangers. So making time for them on a one-to-one basis, as well as doing the other activities, is very important, really. I would say, go with an open mind. I hadn't a clue what I was doing that day I walked in that building. I didn't know what to expect at all. There's routines there that I didn't expect. The amount of professional people that come in and people that do get involved with residents to help them, with mobility or anything. So I would say, yeah, just give it a go. Go in and just see what you think. And actually, you make it what you want it to be. And I think I've gone from somebody who was very shy, who wouldn't talk to anybody, to now who just gets on with everything. And my residents see that, and they know I go in with a smile on my face. They know I'm the one who's going to try and do something for them that day. So yeah, just go for it. You've got nothing to lose, really, I don't think.